Hi everyone, Lynn Schulte here with the Institute for Birth Healing, and today I want to talk to you about doing inversions to help rotate a posterior baby. So babies are posterior when you're noticing a lot of kicks and punches straight out in front in your belly. That means that the baby's back is towards your back. And that's going to be a more challenging way for the baby to come on out. So we really ideally want the baby's back to be towards your belly and the baby facing your spine. And ideally what happens is the baby actually kind of curls over on this left-hand side, so you'll feel a lot of kicks over on the right-hand side. That's great, but if you're noticing kicks and punches straight out in front, then you may be dealing with a posterior baby. And one of the critical things that can create a posterior baby is reclining on the couch with your legs up. So you want to avoid this leaning back and enjoying your doggy in this position, because that just causes the baby's back to go towards your back. So when you're sitting, you want to make sure that you're as upright as possible. Put a pillow behind your back. Stay at 90 degrees in your hips, and even, forward if you can. Hang out as much as that baby's belly will allow, your belly will allow, to be more forward as you're sitting, or stay on your side, lay down on your side. So if you are noticing that your baby, you got a lot of kicks towards the front, and you really want to start to be concerned about this around 35, 36 weeks. That's when the baby's head starts to engage. We want around 36 weeks, we want the baby's head down, engaging into your pelvis, but we want it to be where the baby's back is towards the front of your belly. Now, if you're noticing that you're getting a lot of kicks in the front, what can you do? Well, there's a great exercise that Spinning Babies offers, and that's called the inversion. And the way I like to instruct my mamas to do the inversion is to actually use your couch here. And always the first couple times you do this, have someone there to spot you, to help you out. You have your partner right by your side, helping you to get in and out of this position. So what we want to do is we actually want to kneel up on your couch here. So we want to get up on the couch, and here, I like having a table or something, or maybe a coffee table in front of you, not in front, but by your side, to help you kind of walk down. And then you're in this position with the butt up in the air, and you can even, if that's not enough, come on down onto your elbows. And then I like to just do some little movements of the hips, side to side, and really hang out here for about 30 seconds. And hang out in that position for 30 seconds. And then it's super important that you come back up. And if you're having a hard time, you can, use your table to walk back up to get yourself back up. But don't climb down onto the floor to get out of that position. That puts too much strain and tweaking into your pelvis. And we don't want you to create any back pain or issues in your back from doing that. So definitely come back up, and then you can get out of this position. There, okay? So you can do that several times throughout the day to do inversions, to just try to see if we can get your baby. What that does is it takes the baby out of the pelvis and can help them to shift and move around. If your baby's engaged in your pelvis and is in a posterior position, this can help them to lift back up and find a different position in there, and hopefully get the baby's back towards the front of your belly. So that's the ideal position you want to go into labor. Posterior babies cause a lot of back labor during your birth. So we want to avoid that. So try doing some inversions. I also really encourage getting some soft tissue work done in this lower belly, to free up any fascial restrictions or ligamentous tightness that might be contributing to that baby being in that position. Webster-trained chiropractors are trained to treat posterior babies and loosen up the ligaments. Women's health physical therapists can also help you with any restrictions in that lower belly. So good luck, and I hope you have a beautiful birth.